Welcome back to The Exam Room, a podcast where we dive deep into the world of value-based care, patient-centered healthcare, and improving health outcomes with your host, Dr. Rhiannon Winsor. Dr. Winsor is a certified surgical technologist, healthcare educator, and the manager of training at VB Care Network. With almost 30 years of experience in healthcare and instructional design, she's spent her career helping clinicians and care teams optimize patient outcomes. Welcome back to The Exam Room. In the final episode of our three-part series with Dr. Bhatt, cardiologist and Chief Innovation Officer at the American College of Cardiology, we turn our focus to what it takes to build sustainable, equitable digital health strategies that actually work in the real world. In this conversation, we explore the importance of infrastructure, communication, and culture change, from training staff and educating patients to aligning technology with value-based care and community needs. Dr. Bhatt also shares what gives her hope for the future of healthcare, why patient agency is becoming central to care delivery, and how digital tools can help restore the deep human relationships that drew many clinicians to medicine in the first place.
I would be willing to say that all health centers at some level or practices are using some sort of digital health tools. What would you say, in your experience, would help them to create some sort of sustainable strategies for their patients?
Infrastructure. You can't just say my patients are going to use this. Yeah. You have to have a large communication campaign in your clinic or health system saying, here's the way we're using this new AI system, digital health system. Here's what it does. Here's when it gives you information. Here's when it doesn't. You have to tell that to the patient in language they understand. You have to tell it to the clinicians. You know, when we first started telemedicine and then in COVID, there were some patients that just weren't doing it in one part of the practice. We couldn't understand what was happening. And I then happened to walk by one of the administrative assistant's desks, and I heard her saying, you know, the doctor could see you in person, but not that day. I know it's not great, but if you want, they can see you over video. I know it's not great, but, right? Mm-hmm. And so she didn't mean anything by it. Nobody had given her a script and the communications and explained to her the value of it. And later when we did, she said, oh, in that case, all these people over age 80 who in February are coming to Boston in the snow and ice and risking a hip fall, can I put them all on a televisit? And I was like, absolutely. That is exactly what you should do for people who want it. And so communication, it's huge. And you have to think about everybody. You can't just communicate to one person or other. Who are all the people on the patient journey that touch this experience? Have you communicated to them what their role is in this new way of doing things, right? I think it's incredibly important.
Yes, I think communication is a key too, and education and or training, not to just say, okay, well, we're going to ramp up our telehealth and this is what we're going to do. And okay, here, go do it, but to actually have support structures in place so that clinicians, physicians feel comfortable, because that is a different mindset. I would think. I'm not a physician. I kind of compare it to teaching in person and teaching, virtually. But there's a different way that you have to do things, and clinicians need to be comfortable with that.
No, I think that's exactly right.
Is there any advice that you would have for FQHCs and value-based organizations that are adopting these digital strategies?
A few. So one is have some form of infrastructure, like a plan that everybody follows. It's the same thing. And then measure what's happening, because then you can iterate on it. But if you let everybody do things differently, then you can't really figure out what works and make it better. And then you're kind of more likely to fail. So I think that's one thing. The second is, I don't know if people have heard about the Access program. So the Center for Medicare and Medicaid Innovation last Monday announced their new Access program. And it is a payment structure that allows digital health companies that can do kind of continuous monitoring, other things at home, to help take some of the load of that care and communicate with clinicians and patients, and then get paid by the government. One of the challenges for an FQHC or any kind of rural or inner city hospital that can't, or health system that can't really afford to pay for technology upfront for potential benefit, right? It's just, we don't have the margins for that. But now we don't have to. We can send our patients to these kind of systems if we engage with them, and then know that those kind of digital health companies, in order to get paid, have to create outcomes. And maybe the first year it's going to be 50%, 75%. I'm not sure of the numbers yet, but those companies are obligated for the government to create good outcomes to get paid. Unfortunately, money still talks, right? So in that sense, we can rely on it. The one thing at the American College of Cardiology that we're doing, and I think what's really important, is you can have a system like an FQHC, and you can have a technology company. And even if you say, hey, system and technology company, we're going to pay for this, you guys don't have to worry about it, just get together. It's not that easy. And so I spend most of my time working with the technology companies, because it would be too hard to work with every health system. Although we do work with health systems, but it's easier to go straight to the technology and say, hey, this is where you're best suited to be. This is how you're going to do it. Come into the health system, start working. If there are things not working, we're here to help you figure it out. But you have to realize that the infrastructure of combining technology and health system that hasn't really been technology heavy, that's not going to be easy. But I do think that people like us and others can ease the glide path for that to happen, because it's, once it happens, just think about the volume of patients that you can provide care for in the communities where they live. And that's actually really important, because we're talking about hourly wage workers. We're talking about people who have childcare and elder care, who may not have transportation. And so there's so many things about, hey, just come see the doctor, that is just not considerate of like the human condition, right? Just come in and see me is actually maybe the least considerate thing one can say, even though the healthcare system may feel like, oh my God, we're so nice, we say, come see us. I get that, but it's not that easy to come see you when I have a whole life out here. And so I think that's kind of the most important thing when we think about the digital health and access program and FQHC is, what's the infrastructure? How do you make it work? How do you make it meld? And that's literally what I spend every day doing. As you can tell, I'm excited about it. I think there's a lot of potential.
So as we are wrapping up here, what gives you most hope about the future of healthcare? Digital, not digital healthcare, the future.
I would say my daughters. They are Generation Z, and I guess the younger one's just called Alpha. I don't know. but they're 12 and 18. And their take is, well, it's my health, it's my data. I'm a partner in this. There's no expectation that anybody will tell me what to do. There's an expectation that I'm supposed to do the right things. And there's this, maybe this comes from me, this idea of moderation. Like, you can do a little of anything, right? Well, not anything, but but by and large, like, thinking about being healthy is important. And I see that in both of them. In fact, the younger one, I see that not only for herself, she sees it for the planet. I mean, she's constantly telling me about sustainability and climate change and what we're doing. And so she's not just seeing it for herself, she's seeing it for humanity. And so I see these younger generations coming, and that's part of what drives me to say there's no differential between digital health and health. The field of healthcare is changing because the world is changing and becoming more digital, more technologically savvy. But that's not it. The world is also becoming where people no longer want to be told you have to do this. Like, medicine is not paternalistic or maternalistic anymore. It is a partnership. And these new generations, they expect to be partners in their healthcare. And for us to suggest that they should be anything less, then we're the ones who are kind of thinking backwards about it. So we have to reframe the way we think about it. So again, patient agency, that's all the hope. Like, if you take patient agency and you just embrace it, then digital technologies are a natural part of health.
Yes, it makes me think about a LinkedIn post that I saw. she's a patient advocate, and she says that, her one client has this physician that she just loves. They both drive 4 hours to meet in the middle with this physician, and they were going over some labs, and she said, I just kind of had this aha moment where the nurse that was going over the labs was really focused on everything that was wrong and what the patient wasn't doing right and those kinds of things. And the flip side was the physician really focusing on, it's not exactly where we want it, but it has improved, and this is the positive, trends that we're seeing, and, really did the critical thinking to, and almost put himself back in the seat of, what am I not doing? But there has to be that balance there, I think, between the two of, physician and patient partnership.
I'll end with one thing, which is, I think we can do a better job educating patients. Mm-hmm. I think there's a lot of misinformation that gets to the average human long before the healthcare industry does. And part of it is our academic nature. And I think we need to move to more of an empowering approach. And I think that infrastructure is one of the hardest to figure out how to build, because the average doctor or nurse or pharmacist doesn't think, hey, I'm going to reach my patients by TikTok or Instagram, right? That seems, oddly enough, for many people, and I'm not saying this is me, although maybe it was at one point, that seems less than as a way to reach people. But that's not fair. Any way you can reach people, you need to be reaching them if you care about health. Yeah. And so I think that's really important, is coming to the patient where they are. And that's what makes them a partner, is you see them where they are. And so I think there's a lot of hope in the future, but most of it's going to be culture change on our part. The staid and storied institutions have to come into the 21st century along with everybody else.
Absolutely. Thank you so much. This conversation was really amazing, and it was great having you as a guest on the exam room.
Oh, thank you so much for having me. I'll end with one quick thing, which is, you were talking about the two patients who drive 4 hours to see each other. One of my friends who was a patient, I took care of her, and then I took care of her dad, who then had a heart attack. This was one of the times that, like, being medicine and pediatrics, as we were talking about in the beginning, came back. Mm-hmm. I went to their wedding, and I just recently got a copy of their wedding video. And I was invited to their wedding. The nurse who works with me and took care of them and I were both at the head table. It's really sweet of them. When they do their father-daughter dance, I mean, talk about ugly cry. I am, like, in the background sobbing. I did not realize the video was watching them dance, but the head table was in the background. There I am, like, snot flowing, and I'm crying. But part of my hope is that we've gotten so far away from that relationship in some cases of healthcare. Like, people really hold on to the relationships where you drive 4 hours to be together. And I'm really hopeful that a lot of digital health and AI and the rest of this takes away the noise, so that, like, those, like, ugly cry, snotty moments, like, that's what doctor-patient relationships are made of again, right? So I think we're going to get there. I really have hope that we do.
Thank you for joining us in the exam room, where we examine the vital signs of value-based care and diagnose what's shaping the future of healthcare. We hope this conversation was as insightful as your last checkup. A big thank you to our guests for sharing their expertise and prescribing actionable ideas. Stay tuned for more episodes as we probe the topics that matter most in value-based care. Until next time, take care, and thanks for listening to The Exam Room.